Hi, this is Captain. Today I'm going to show you about horses that are really sensitive to their ears. He's actually been ridden and he's just got up from lying down, so he's quite sleepy, so he's not going to be as reactive as normal. But let's see. You can see if he was really alert and feeling very sensitive, you can see the reaction there. Okay, but this is quite passive. Now, many horses are sensitive to their ears, and there's quite a lot of different reasons for it. Sometimes it's because they've been ear twitched, a common practice, either with a natural twitch or people grab their ears and pull them down to try and control them. That can cause quite a lot of damage, as well as psychological. You know, the horse knows that if you're going up there, you might be doing that, so it doesn't really want you to go near it, even though it might not have damaged it. Also, banging a horse's head, you know, having stable doors, low roof, banging their head, or haltering them for the first time, pulling themselves over backwards, damaging this area, or just pulling back and breaking loose can also damage the area. So we have to sort of decide whether there is damage or if it's just psychological. He knows I've got a treat in my pocket, so he's being particularly loving at the moment. So it's a very, very vulnerable area anyway. You've got the occipital crest. It's an occipital bone that's right at the back of the skull. And you know, if you ever get a chance to have a little feel of it, all horses are different, just like us, but it's a very, very angular and pointed bone. And its vulnerability, if it gets banged, yeah, it can create you know, tiny little splints on it, etc. And then you've got the nuchal ligament that comes into it, and it attaches there. Again, if the nuchal ligament is strained, you can create little micro tears, and that can cause damage. There's an awful lot of muscles up here. The big muscle on top is the splenius, and just below it is the brachiocephalic, and the tendons of the brachiocephalic. Underneath, you've got the rectus capitis and the oblique capitis, posterior and anterior. You've also got some tendons of some other muscles. Hello. You've got the semispinalis capitis, the longus capitis, and the longus atlantis. And these are all underneath, and these tendons are quite vulnerable, and you can feel them as you're massaging the horse. So what do we do when a horse is like this? Obviously, you give them the odd treat to try and encourage them that you can put your hand up here. Things like, you can see clipping him. I didn't bother to clip him out up here at the moment because he's doesn't need to compete, he doesn't need to look particularly smart, and at this point in time there's no point in making him more upset. But if I did have to, I would probably have him doped to do so. And again, with pulling his mane, I didn't pull his mane because, again, that would create more problems. He had it trimmed with a pair of scissors, I can admit, and a trimming knife. Okay. Also, the bridle path, I did that very, very carefully one day because you want some of this hair out of the way. Putting a head collar on, you want to put the head collar on over his nose and then pull this over. Yeah, don't push it over the ears. As a regular thing, every day in, day out, make it easier for the horse. Bridling him. When you do bridle, now that you would push the ears back as you bring the headpiece over the ears. Don't try and pull the ears forward or grab hold of the ears and pull them through the bridle, if that makes sense. So, and try and have the bridle long enough so that when it pushes over the top of the ears, it's a lot easier for the horse. And again, in that situation, I would try and treat the horse and trying to get him to keep his head low to do that. But if they're really, really bad, you obviously have to take the bridle apart and build it up around them, which is quite a ball. So, some of the top tips when you're dealing with a horse that is very difficult around its head, and like I say, he's not too bad at the moment. Some can be incredibly violent, and if he's feeling very sensitive on a day, he can be pretty bad. One of the top tips is whenever you're doing something, putting head collars on, bridling, pulling their mane, anything like that, is keeping them away from walls, low roofs, so that when they do, if they do suddenly jerk away from you, they don't bang themselves, because then that, obviously that makes it even worse. Because then they get pain associated on top, associated with their psychological problem they've got with their ears already. So try and be safe, keep plenty of room, and I would also always suggest allow the horse to move away from you. Don't try and hold it in place, because you'll create even more damage probably by doing so. And if you've got a really, really bad problem, you've got it very, very vulnerable, if you do need to tie up, pull the head collar back here so it's on a less sensitive area. Okay, the bridle path area is incredibly sensitive, so if you're having to tie up for any length of time, just keep pulling it back just to relieve the horse a little bit. The other reason it's so sensitive are the nerves. There's an awful lot of nerve endings coming out in this area. You've got C1 nerve that comes out literally, if you can see, just above here, and C2 nerve comes out just behind the atlas, between the atlas and the axis, about here. But this one here is it's just under the splenius, it's very, very active, and if that gets damaged or the muscles are tight, then that can get pinched and become more reactive. And a horse, a chestnut horse in particular, they've got more nerve endings per square inch than most other horses. And it's like red-headed people, it's the same is true. So, but from a massage point of view, because you're really trying to figure out if it's just psychological, you've got the problem, and certainly the way this horse's treats do help him to forget his ears, you'd think it is more psychological than physical damage. But as a massage therapist, as I come up here and I have a feel of some of these muscles and tendons, they're not brilliant, okay? There's a lot of tension in them. You've got a big tension knot this side, which isn't the same on the other side. So I can tell, as a massage therapist, that there is some damage and some tension in this area, which needs to be resolved to help. And as a therapist, you've got to decide the most tactful and the best techniques to use to help the situation. Sometimes the horse is so uptight that you have to use very, very subtle techniques to get what you want to begin with. As you can see, old Lazy Jaws, who's been asleep this afternoon, is feeling a lot more happy about me giving this a massage today and working on it. Good boy. Thank you. Goodbye from me and Captain. Captain.